There is one oil sitting in your kitchen right now that most American seniors pour into their pan every single morning, believing it is one of the healthiest choices they can make. Their doctor recommended it. The label says heart healthy. The commercials have been saying it for decades. And yet, if you have sciatica, this specific oil is doing something to your sciatic nerve every single time you cook with it that is directly counteracting every supplement you take, every stretch you do, and every effort you make to reduce your nerve inflammation. It is not a mystery ingredient. It is not something obscure. It is the most widely used cooking oil in America. And tonight, I am explaining exactly what it does to your sciatic nerve and exactly what to replace it with starting tomorrow morning. And real quick, right now, before we go any further, if someone you know has been struggling with sciatica that never fully improves despite doing everything right, pause right now and send this video to them, because what they are about to hear might be happening in their kitchen every single day without them knowing it. And if you are not subscribed yet, hit that subscribe button right now. Every week, this channel brings you honest, practical information that most people never discover. Now, let us get completely into this. My name is Dr. Michael Kent, and in 20 years of senior health practice, one of the most consistent patterns I have seen in patients whose sciatica never fully resolves is this. They are doing the right things, taking the right supplements, doing the right stretches, sleeping in the right positions, and their pain improves, but never completely. It reaches a plateau and stubbornly refuses to go lower. And when I dig into their daily habits, their food, their cooking, their kitchen, I often find the same thing. A large bottle of canola oil sitting on the counter, used every single day for years. Before I explain why that matters so much, let me tell you about a patient. All details have been changed to protect privacy. A patient came to me, a senior in their mid-60s, who had been managing sciatica for approximately 16 months. They were genuinely committed to their recovery. They took their supplements every morning without fail. They stretched every evening. They had changed their diet significantly, cutting out processed foods, eating more vegetables, reducing sugar. By every measure, they were doing the right things, and their pain had improved from its worst. They were clear about that. But it had settled at a stubborn 4 out of 10 that nothing they did could move lower. During one appointment, I asked them to describe exactly what they cooked with every day. They listed their usual meals. And then they mentioned, I always use canola oil. It is the healthy one, right? That was the moment everything clicked. I asked them one simple question. Would you be willing to replace your canola oil with extra virgin olive oil for the next 4 weeks? Nothing else changed, and see what happens? They agreed. They thought it sounded too simple to make any real difference. 4 weeks later, they came back. Their pain score was 2.5, the lowest it had been in 16 months. They looked at me and said, "It was the oil?" I said, "It was the oil." Tonight, I am explaining exactly why, in the simplest possible way. Here is all you need to understand. Your body makes 2 types of signals. Signals that turn inflammation on, and signals that turn inflammation off. The food you eat every day determines which signals your body makes more of. And the type of fat in your cooking oil has a massive effect on which direction that balance tips. Canola oil is loaded with something called omega-6 fat. Omega-6 is not evil. Your body needs some of it. But when you consume too much omega-6, and most American seniors consuming canola oil daily are consuming way too much, your body starts producing large quantities of inflammatory signals. Specifically, the kind of inflammatory signals that go directly to your sciatic nerve and keep it irritated, sensitive, and painful around the clock. Think of it this way. Imagine your sciatic nerve is a fire that you are trying to put out. Your supplements and stretches are the water you are pouring on the fire. But canola oil, used every single day in every single meal, is like someone quietly adding a cup of fuel to that same fire every time you are not looking. The water helps, but the fire never fully goes out because the fuel keeps coming. Stop adding the fuel and the water finally wins. That is canola oil and your sciatic nerve, in simple terms. Now, here is the part that most people find most shocking. It is not that canola oil is a bad oil in every situation. For people without chronic nerve inflammation, it may be perfectly fine. The problem is specific to people with sciatica and other chronic nerve pain conditions. Because a nerve that is already inflamed and already hypersensitive is far more vulnerable to the inflammatory signals that excess omega-6 produces than a healthy nerve. Your sciatic nerve, in its current inflamed state, is like a room that is already warm. Adding a small space heater, canola oil's daily omega-6 load, barely affects a cool room. But it dramatically overheats a room that is already warm. Your nerve is the warm room. Canola oil is the space heater you keep turning on every single day. Research published in the journal Prostaglandins and Other Lipid Mediators confirmed that high dietary omega-6 intake from refined vegetable oils directly increased the inflammatory compounds most responsible for peripheral nerve sensitization, with the increases directly measurable in the nerve tissue of patients with chronic pain conditions. This is not a theory. It is documented, and it happens in your kitchen every time you reach for that canola oil bottle. Now here is the good news. And the good news is genuinely excellent. Replacing canola oil with the right alternative does not just remove the inflammatory fuel you have been adding to your sciatic nerve every day. It actively adds anti-inflammatory support that works in the opposite direction, producing the signals that turn inflammation down rather than up. And the results, as the patient in our story experienced, can be dramatic. Not over months, over weeks, sometimes over days. Here are the 3 oils to replace canola oil with immediately, like starting tomorrow morning. The first and most important replacement is extra virgin olive oil. This is the one that made the difference for the patient in our story. Extra virgin olive oil contains a compound called oleocanthal that works in almost exactly the same way as anti-inflammatory medicine, reducing the same inflammatory signals that are sensitizing your sciatic nerve. It also has a much better omega-6 to omega-3 balance than canola oil, meaning it does not add the inflammatory fuel that canola oil does. Use it for low to medium heat cooking, salad dressings, and drizzling over vegetables. Buy cold-pressed extra virgin, not just olive oil or light olive oil. The cold-pressed extra virgin version has the highest oleocanthal content. Available at every major grocery store in America, including Walmart, Costco, Whole Foods, and Trader Joe's. The second replacement is avocado oil. For high heat cooking, frying, roasting, searing, avocado oil is the best choice because extra virgin olive oil is not ideal for very high temperatures. Avocado oil has an excellent fatty acid profile for sciatica patients. High in oleic acid like olive oil and very low in the omega-6 fats that canola oil is loaded with. It has a neutral flavor that works in almost any recipe. Available at Costco in large bottles at very reasonable prices, making it affordable for daily cooking use. The third replacement is coconut oil for baking and certain cooking applications. Coconut oil is a saturated fat, which sounds counterintuitive to many seniors who have been told to avoid saturated fats for decades. But the medium-chain saturated fats in coconut oil do not produce the omega-6 inflammatory cascade that canola oil does. They are processed differently by the body and do not contribute to the arachidonic acid inflammatory pathway that sensitizes your sciatic nerve. For baking, muffins, cookies, pancakes, replace canola oil with melted coconut oil at a 1-to-1 ratio. Here is your simple action plan for tomorrow morning. Open your kitchen cabinet, take out your canola oil. Set it aside, go to your nearest grocery store, Walmart, Costco, Whole Foods, wherever you regularly shop. Pick up 1 bottle of cold-pressed extra virgin olive oil and 1 bottle of avocado oil. Come home. Use the olive oil for everything you would normally use at low to medium heat. Use the avocado oil for everything at high heat. Never reach for the canola oil again. That is the entire change. Nothing else. No new supplements, no new exercises, no new protocols, just 1 oil swap in your kitchen. And give it 4 weeks before you assess the difference in your sciatica. While you're at the grocery store, also check the labels of any other packaged products you regularly use. Salad dressings, mayonnaise, marinades, packaged sauces, and baked goods. Canola oil is hidden in an extraordinary number of processed food products, even ones marketed as healthy. Any product listing canola oil, soybean oil, corn oil, or vegetable oil in its ingredients is adding the same omega-6 inflammatory fuel to your sciatic nerve that your cooking oil was adding. Replace salad dressings with olive oil and lemon juice. Replace commercial mayonnaise with avocado oil mayonnaise, available at most grocery stores under brands including Primal Kitchen and Sir Kensington's. These small swaps add up quickly, and the cumulative reduction in daily omega-6 load to your sciatic nerve is significant. Now, here is something important to understand about timing. The anti-inflammatory benefit of removing canola oil and replacing it with olive oil does not happen overnight. Fatty acid composition in your cell membranes, including the nerve cell membranes of your sciatic nerve, changes gradually as old fatty acids are replaced by new ones through the natural turnover of cell membrane components. This process takes 2 to 4 weeks of consistent dietary change to produce measurable shifts. This is why the patient in our story assessed their results at 4 weeks rather than 4 days. Give the oil swap 4 full weeks before making your assessment. Most people notice the first shift between weeks 2 and 3. The patient from our story has been cooking exclusively with extra virgin olive oil and avocado oil for 11 months. Their average daily sciatica pain score has remained at 2 to 3 since the 4th week of their oil swap, the lowest sustained level they achieved in 16 months of trying everything else first. They told me at their most recent appointment, "I spent 16 months looking for the complicated solution. It was in my kitchen cabinet the whole time. Tonight it might be in yours too." In 20 years of practice, the simplest interventions are sometimes the most powerful, not because the science is simple, but because the daily impact of something done every single day and every single meal compounds in a way that a supplement taken once daily simply cannot match. Your cooking oil touches every meal, every day, for years. Getting it right is not a small change. It is one of the most high-leverage dietary changes a sciatica patient can make. And it starts tomorrow morning with one grocery store visit. Now, before you go, drop a comment right now and tell me your age and your city. And tell me, have you been cooking with canola oil? Are you going to make the swap tomorrow? I read every single comment personally. Share this with someone whose sciatica has never fully resolved despite doing everything else right. Subscribe and turn on notifications, because every week this channel brings you something equally simple and equally powerful. One oil swap. Tomorrow morning. Your sciatic nerve finally stops receiving the fuel that has been keeping its fire burning. This video is for educational purposes only and is not medical advice. All patient stories have been changed to protect privacy. Individual results vary. Dietary fat changes may affect cholesterol levels. Consult your healthcare provider before making significant changes to your cooking oil use if you are managing cardiovascular conditions or taking cholesterol medications. Dr. Michael Kent is a senior health educator with 20 years of experience in senior wellness. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.